All right, so just to finish up this slide of our foot injuries and conditions lecture, I was just leaving off on the last PowerPoint, part 1, that sometimes people will need orthotic or realignment surgery in more severe cases, where they just go in, surgically shave down the bone and help realign the first metatarsal with the big toe. All right, one of our last conditions here, Morton's neuroma. This is when there is an enlargement of the plantar nerve. So if we look over on the right, this yellow bubble is depicting our nerve bundle in our foot. And Morton's neuroma usually happens between the third and fourth metatarsal, right on the bottom of the foot. And this is just getting enlarged or irritated, usually from the third and fourth metatarsal bones pushing in on it, or some overuse as well. The person will experience intermittent pain, sometimes radiating down into the toes following the nerve path. They could also have burning and numbness in that area, and symptoms are going to increase if the person is wearing very narrow or tight shoes, or if they are continually going into hyperextension, so if they're pushing off their toes a lot. Sometimes we can help this by separating toes with padding. So we can place a little pad between the third and fourth toe, and that can help keep the bones apart, just enough to not irritate the nerve so much. Okay, turf toe. This is a really common injury for athletes that are always in the hyperextended position. So usually it's going to be sprinters or football and basketball players who are always pushing off their toes. Turf toe is going to be hyperextension of the big toe. So we are spraining the ligament. So if we look over on the right, there's an image of the ligament and some pain there. The ligament can tear or sprain after so much overuse of hyperextension. Usually this happens on a hard surface. So it got this name from football players being on the line in the three-point stance on hard turf and pushing off their toes. Sometimes tape or a rigid insert to avoid bending of the shoe can help. But we also do a lot of strengthening therapy of the small muscles of the toes and bottom of the foot. And then as a last resort, we can consult a doctor for a cortisone injection, which is going to be a steroid anti-inflammatory and can help with the pain. All right, and then lastly, we have calluses and blisters. These are just formed from friction. They're very common, usually not causing any major issues or problems with an athlete, but they can be just painful enough to where they have to get it treated or have to change their shoes from it. So usually we try to prevent it with good socks, good shoes. We file the calluses immediately if they're starting to build up too large. Blisters should be cleaned and drained if they're causing an issue. And then we will cover everything with padding to prevent any further irritation of that area. Okay, so this is a list of palpations that I want you guys to get familiar with and practice on your own. According to the anatomy slides that I've showed and these descriptions here, I want you guys to try to find them on your own, and then we can talk about them in our next live Zoom next week. There's just a list of all the different bones we've gone over, and then a short description afterwards. So I want you guys to practice that this week, and we can talk about it next week.